Assalamu alaikum. So, in the last session we were talking about fracture, and we were talking about type of splint. Just we will remind you with the type of splint. The three type of splint is the hard one. The hard one we said that might be a piece of wooden piece, but it has to be smooth and it has to be regular, and it has to be wrapped with cotton or with a piece of cloth. It might be also any metal like aluminium. They are using sometimes. They are using plastic. The soft splint, the material of the soft splint, it can be a blanket, it can be a bed sheet, or a newspaper, wrapped newspaper. The anatomical, we said we are using here the client own body part to support the fractured one. Like if it is in the hand, we are supporting it by the chest. If it is the finger, we are supporting the fractured one with the healthy nearby finger, and we will wrap them together. If it is the leg, we will wrap the two legs together. This is the anatomical one. So this is hard splint used for the hand, but also, as we said, it has to be hung with a triangular bandage. The soft splint here, they are using a type of sheet and they are wrapping it then with a bandage. This is hard splint. They are here. It is a metal bars. They are using it for fixing that part of this worker leg. Here they are fixing it, those bars with ropes. Here they are using anatomical splint by fixing the two legs together. So applying splinting, we have to support the injured. This is the thing that you have to be sure of it when you are, in order to be sure that the limb is fixed properly. So in order to fix the limb properly or the part properly, support injury arm above and below the site of injury. So if we are supporting it just from the site of below the injury, in this case, what's happened? We are adding some heaviness to the area with nothing. So it will make it also more difficult to the client. It is useless. So it has to be above and below the site of injury. Place the triangular bandage under the arm over the uninjured shoulder. So in order to fix or to hang the arm, we will show you how to use that. Wrap the outside of the bandage around the other side of the necktie on the side of the neck and add padding. Bind the arm to the torso or to the chest with folded bandage, and check for the circulation on that. This is the arm splint, how it is done, and it will be seen like this. We will show you how to do that. This is arm splint again. When we have to call for 9999 or for the emergency number, the local emergency number at the end. If there is obvious deformity, in this case we have to call. There might be another injury, bleeding is there, moderate or severe swelling and dislocation, we have to call in this case. Bone sound or feel like they are wrapping together, it is definitely fracture and we have to call. A snap or pops was heard or felt at the time of the injury. In this case, it means that fracture is already there and we have to call. an open wound with bone pieces appear on the injury site, also in this case we have to call and we have to transfer the client to the hospital. When the client also or the person cannot move the affected part normally, an injured area is cold and numbness is there. When coldness and numbness is there, what does that mean? It affecting what? Sorry? Yes, thank you. So it is affection of the blood supply. So it means that the blood supply is not well at that area. Injury involved the head or neck or spine. In this case, it need a proper way of transfer, and we should not move that client. If the injured person has trouble with breathing, difficulty in breathing, if it is not possible to safely or comfortably move the person to vehicle for transporting to hospital, if it is difficult to move him and transferring him to a vehicle, in this case, definitely we are in need for the ambulance and to take him to the hospital. What to do until they arrive? As we said, we have to use the RICE, which is rest, so do not move or straighten the injured area, trying to return it back to its normal, unless if you are trained for that. Immobilization, stabilize the injured area in the position that you found it as it was, just in order to prevent any movement, because any movement we said that it might increase or it might lead to further injury. Called for a period of about 20 minutes, applying cold over it. Place a thin barrier between the ice and the bare skin. So we will not apply the ice directly over the skin. Sorry. We have to apply a thin piece of cloth in between the ice and the skin. Then elevate the injured part only if it does not cause more pain. If it causes pain, we will keep it as it is. Splint the injury using the splint. Dislocation, this is types of dislocation. This dislocation means that the bone are away from its side. See here in the X-ray, this is the elbow joint. So the bones, the head of the bones are away from the side because of there is tear, either tear of the ligament or overstitching to the ligament. Because of that, it's a tear line. Checking and caring for dislocation. Dislocation will produce pain in the joint and also loss of normal movement of that joint. So the person who are having dislocation at that joint, he will not be able to move that joint. Joint look wrong. So it is not the normal view of that joint. It is not similar to the other hand or to the other part of the body. It might be shoulder, it might be elbow, it might be the knee joint. So that side, it is asymmetry. Many dislocation can only be splinted in the field. We can splint them on the field. Some can be put back by realignment through a process called reduction. But also reduction as a first aider, not all first aider are trained well for doing reduction. So it needs an experience. So in this case, as a new first aider, you have just to transfer, to fix the client, prevent movement, transfer them to the hospital, then they will do the reduction. Either the reduction, it might be open reduction or closed reduction. Open reduction, it means by operation. Closed reduction, it is without surgery. But also the reduction, it is painful. So the person is in need for strong analgesic or anesthesia in order to do the reduction for him. Thank you. This is the part, theoretical part. Now we will go